good evening, everyone. I welcome you all to the series Mastering Variance Emission Page by Page. And today we're going to cover the second part in the breast series. And I'm going to teach you today infectious and the benign disorders. So this lecture has been divided into two parts. In the part one today, we're going to cover gynecomastia and the infectious and inflammatory disorder. And in the part two, I'm going to teach you about the benign disorder of the breast. So I'm Dr. Shailesh Gupta. I'm a laparoscopic bariatric and robotic surgeon at Max Patparganj in Vaishali, Delhi NCR. So this will be a flow of lecture. So as the series name goes by page by page, so what we are doing here, we are covering the standard textbook page by page. And basically the series goes by the name of Mastering Variance Resistance, but in the case of breast, it is best given as Schwartz. So this series breast as I've taken from the Schwartz. So before starting any topic, there will be few MCQs coming, and the purpose of which is to get your awareness. Check. So no worries. So what we're going to study today, I'm going to teach you about gynecomastia, infection of breast, bacterial and fungal, and also about Hiradentitis suppurativa, and also in the last, I'm going to teach you about the Mondors disease. So first topic of today is gynecomastia. ठीक है, बहुत ही इंपॉर्टेंट टॉपिक है, बहुत ही मोस्ट प्रेवलेंट डिसीज है. सो आपको बेसिकली शॉर्ट नोट भी आ सकता है इसके ऊपर. एंड ऑब्वियसली इन योर क्लिनिकल सर्जिकल क्लिनिकल प्रैक्टिस यू गोइंग टू सी लॉट ऑफ पेशेंट्स. So you should, as a surgeon, we should know its etiology and how to diagnose it and what you can do in this disorder. So few MCQs before starting the topic. Number one, which grading of gynecomastia involves marked breast enlargement with skin redundancy and ptosis? So 3 पॉइंट है इसमें, marked breast enlargement, skin redundancy and ptosis. Grade 1, grade 2A, grade 2B and grade 3. Question number 2, which pharmacological agent has been successful in reversing the gynecomastia, but it is associated with the considerable androgenic side effect? Tamoxifen, clomiphene, danazole, or testosterone. Question number 3, which of the following condition is associated with a hypoandrogenic state and an increased risk of breast CA? Klinefelter syndrome, Turner syndrome, Marfan syndrome, or polycystic ovary syndrome. So I would request the student, they can write their answer in the chat box. That will make the lecture more interactive and also will help you to remember what you answered. Question number 4, which medication is most likely to cause gynecomastia due to its estrogenic activity? Digitalis, metformin, atenolol, or warfarin. Question number 5, which of the following drug is known to inhibit testosterone synthesis and may cause gynecomastia? Cimetidine, ibuprofen, Rantic, ranitidine, and acetaminophen. So which of the following is a nutritional cause of gynecomastia? Protein and fat deprivation, excessive carb intake, high protein diet, and excessive vitamin D intake. Question number 7, which of the following endocrine disorder is commonly associated with gynecomastia? Hyperparathyroidism, hypothyroidism, hyperparathyroidism, or Addison disease, right? Question number 8, what is the primary difference between grade 2A and grade 2B gynecomastia? Presence of skin redundancy in grade 2B. Breast size in grade 2B is larger. Grade 2 involve only one breast. Grade 2B involves nipple retraction. So this is according to the staging of the gynecomastia. So guys, आपने MCQs में देखा होगा कि these are the real MCQs और I've tried to take from the line of this. So हम यहाँ पे MCQs के अंदर एक टॉपिक भी पूरा कवर कर रहे हैं. Question number 9, what is the primary indication for considering surgical treatment of gynecomastia? हम surgical treatment gynecomastia कब करेंगे? When the gynecomastia is caused by a drug, when there is a persistent or progressive gynecomastia which is unresponsive to the medical therapy. So we're going to treat the gynecomastia in adults by surgery or all of the above. So moving on. So now after the pre-test, I'm going to start the topic. So This slide is very basic about the gynecomastia. What is gynecomastia? Gynecomastia is basically enlarged breast in the male. Simple definition. Okay, it could be physiological or it could be non-physiological. So first, I'm going to discuss about the physiological gynecomastia. So there are certain phases of the life where there is a physiological enlargement of the male breast. ठीक है? सबसे पहले न्यूनेटल पीरियड के अंदर जनरली हमें फिजियोलॉजिकल gynecomastia देखने को मिलता है. And why this happen? Because placental estrogen crosses to the baby and act on the neonatal breast tissue, right? And in adolescence also we see the physiological gynecomastia, and it happens between 12 to 15 years of age and is caused by the excessive estradiol related to the testosterone. And in what is characteristic of adolescence, that adolescence के अंदर आप देखोगे तो एक unilateral involvement breast की ज्यादा होती है, तो एक थोड़ा सा डिफरेंस है adolescence के अंदर. अब नेक्स्ट इज सेनेसेंस एट द ओल्ड एज. ओल्ड एज के अंदर क्यों होता है? बिकॉज हमारे सर्कुलेटिंग टेस्टोस्टेरोन लेवल है दैट फॉल्स डाउन, सो रिलेटिवली हमारा एस्ट्रोजन बढ़ जाता है एंड इट इज कैरेक्टराइज यूजुअली बायलेटरल होता है ये. ठीक है, तो हमने अभी तीनों फेजेस डिस्कस कर लिए जो कि फिजियोलॉजिकल गायनेकोमेस्टिया के थे. So now important thing is that what is the basic pathophysiology. Basically क्या gynecomastia के अंदर पैथोलॉजिकल लेवल पे क्या हो रहा है, एक तरह से माइक्रोलॉजी हिस्टोपैथोलॉजी लेवल पे क्या हो रहा है. सो बेसिकली जो डक्टल कंपोनेंट है ब्रेस्ट का, basically there are two components, stromal and ductal component, as I told you in the previous lecture of the anatomy. So in the gynecomastia, basically there is enlargement of the ductal component, there is elongation and branching of the ductal structure and increase in the epithelium. Basically ductal structures की proliferation हो रही है, ये आपको याद रखना है. ठीक है. So now we're going to discuss about the detailed causes of gynecomastia. Basically हमें ये याद रखना है gynecomastia का हार्मोनल का बेसिक है. एस्ट्रोजन जब भी ज्यादा होगा तब gynecomastia होगा, टेस्टोस्टेरोन जब भी कम होगा तो gynecomastia होगा. तो बेसिकली ये दो हार्मोन्स हमारे, जैसे मैंने आपको पहले भी बताया था, ये दो हार्मोन्स हमारे कहीं ना कहीं हमारा दे कंट्रोल द बेसिकली the breast development. ये बहुत इंपॉर्टेंट होते हैं. So first of all, I'm going to discuss about the causes in which estrogen is higher up. Like estrogen higher up could be due to the gonadal origin, that could be found in the true hermaphroditism. It could be also seen in the gonadal stromal neoplasm of the testes, that is non-germinal, which could be Leydig cells, Sartori cells, granulosa theca cells. अब नॉन जर्म सेल्स के अलावा जर्म सेल्स ट्यूमर्स भी होते हैं दैट लीड टू इंक्रीज एस्ट्रोजन सिक्रीशंस. ठीक है, अभी तक जो भी हम बात कर रहे हैं वो गोनाडल ओरिजिन की बात कर रहे हैं. तो जर्म सेल्स ट्यूमर लाइक कोरियोकार्सिनोमा, सेमिनोमा, टेरेटोमा, एम्ब्रियोनल सेल कार्सिनोमा can also lead to increased estrogen, right? And there are certain non-testicular tumors like adrenal cortical neoplasm, lung carcinoma, hepatocellular carcinoma, जो कि मेटाबॉलिज्म को इम्पैक्ट करते हैं हार्मोन्स को. They also lead to increase in the estrogen levels. Endocrine disorders like hypo और hyper, दोनों thyroid disorders हमारे gynecomastia cause कर सकते हैं. Again, liver cirrhosis, whether it could be alcoholic or non-alcoholic, can lead to gynecomastia. न्यूट्रिशन ऑल्टरेशन स्टेटस, अगर हम पेशेंट को प्रोटीन और फैट डिप्राइव करेंगे, ये थोड़ा सा आयरनी है कि न्यूट्रिशन स्टेटस के अंदर प्रोटीन और फैट को डिप्राइव करने पर भी gynecomastia होता है, बिकॉज इट लीड टू ईस्ट्रोजन एक्सेस. ठीक है, जितने भी हमने कॉजेस अभी गिनाए हैं आपको, गोनाडल ओरिजिन, नॉन टेस्टिकुलर ट्यूमर्स, germ cells, non-germ cells tumor, endocrine disorders, liver cirrhosis, and nutrition status, these all lead to increase in the estrogen. ठीक है, अभी नेक्स्ट जो इंपॉर्टेंट टॉपिक आता है, दैट इज बिकॉज